So I'll just go through the agenda for this morning. So as I said, we're just going to do some updates on IPS. Myself and Michael will be joined at 5 to 10 by Colin Kelly, who's going to do the update on data collection. And Dr. Karen O'Connor is going to speak then briefly about IPS in the Early Intervention into Psychosis programme. After that, about 10:15, it'll just be employment specialists who remain on, and everyone else can go about their day. The employment specialists, you'll go into 5 breakout rooms, and we'll talk a little bit more about that coming up to that time. Then be a short break at 11:15, and at 11, Orla is going to join us to do a workshop on boundaries and self-care, and that's specifically for our employment specialists, and we'll finish up at 1 p.m. then. So just to say that for the breakout rooms, could you please just use your full name, name for your identification on Zoom, because Niall is going to put you into the breakout rooms, so he needs to know your full name. So for example, if you're using a phone and the name of the phone is your ID, please just change that to your name. That would make life much easier for Niall and myself. So I'm going to hand you over now to Michael Ryan. Oh, sorry, just to say that we'll be taking questions, but please ask the questions through the chat box, because we're just kind of, I suppose, aware of time constraints. And we are also want to keep the questions, because if we don't get to them all today, we'll get back to you in the coming weeks with the answers to those questions or comments. So as I said, please use the chat box for your questions. And yeah, we're delighted to be here today. And I'll hand over to you now, Michael.
Thank you, Aisling, and good morning, everybody, and thank you for taking the time to come on to our workshop today. And I just want to talk about, I suppose, the question that is on everybody's minds, perhaps, is in terms of the ongoing funding. We know there's been a lot of discussions about it over the last couple of years. So I'm very happy to say that all those have concluded now, and that we have secured the ongoing funding for IPS for all the posts that are currently in place, and additional launcher care posts. And I think that's 35.5 posts in total, and a funding of around 2.13 million. And that funding will repeat year on year. So what that means is that the program is sustained into the future.
Yeah, I can. Yeah. The only way I stand at the moment, I think she's coming on. I assume she's coming on, folks.
Sorry, could you just go on mute, please? If everyone could go on mute, that would be great.
I'll ring her now, sir.
Thanks, guys.
Apologies there for the interruption. So what that means is, with the sustained funding, is the program is sustained, and Aisling will talk about what that means in terms of governance. So I'll hand you over to Aisling now.
Thanks, Michael. So yeah, look, if anyone has any questions, as I say, just put them into the chat box there. And Niall, you can just go on to the next slide. So I suppose, as most of you are probably aware, sharing the vision is now our national mental health policy, and IPS is one of the recommendations within the policy, which is absolutely fantastic for us all. So it's recommendation 71. So a sustainable funding stream should be developed to ensure agencies can work effectively together to get the best outcomes for the individual using IPS model, which is evidence-based, effective method of supporting people with complex mental health difficulties to achieve sustainable, competitive employment where they choose to do so. So I suppose, in terms of sharing the vision, IPS is already one of the early leaders in that we have receive the funding for it. So that's fantastic. So Niall, you can just pop on again to the next one. So the way sharing the vision is working with recommendations and different areas of the HSE, inside the HSE and external to the HSE, have key responsibility for each of the recommendations. In our own office in mental health engagement and recovery, we have responsibility for 10 of the recommendations, including IPS. So the structure so far is there's a national implementation and monitoring committee, and that's the oversight committee for sharing the vision. And then within the HSE, there's the HSE implementation group for sharing the vision. So that's called HIG for short. And we are proposing a mental health engagement and recovery to set up an oversight group for the 10 recommendations that we have. And an IPS national working group would come underneath this. So the way this works, we're hoping is then that this would replace the what was the IPS National Oversight Group to support its implementation. It's up and running now. So what Michael and myself are planning to do is to engage with stakeholders, so our OT managers group, our employment partners, our local implementation groups, in the new year to see how we can, I suppose, best support the governance of IPS through this structure. We are aware that there's SLAs locally everywhere and they have to be addressed as well. And also the SOP, which is now outdated because we have a new funding model, and also because IPS now falls under sharing the vision. So we will be looking to, I suppose, to cement this in the new year. But that is our proposed structure there at the moment, awaiting sign off from the HSE implementation group with that proposal. Michael, is there anything you'd like to add into that?
No, I think that's a very comprehensive summary, Aisling. Thank you. And I suppose we will be looking in how to build on the current levels of IPS and to extend the program to other areas. And I suppose it's just to acknowledge too the work of everybody involved in IPS. The IPS specialists themselves, the people who've been overseeing it and managing it, and yourself, Aisling, because it's a very competitive business to secure funding and that. So, it's testimony to the work that people have done. So thank everyone for their efforts with that. Thank you, Aisling.
Problem, Michael. And I suppose I know a number of questions have come up around the local implementation groups. So the advice is to continue with these. They are falling under Fidelity Reviews as well. So it's important for Fidelity Reviews that those implementation groups are continuing. I kind of spoke to some other jurisdictions on this to see what they were doing with the implementation groups when IPS was kind of set up and established in their areas, and they still continue with them. They might just not meet as often as they would have first when the program was being set up. So just kind of that brings me on to Fidelity Reviews. So we are just gone to the procurement stage of Fidelity Reviews. So because it's such a huge undertaking, we have to go through the procurement process. Niall, you can just go on to the next slide there, please. Through the procurement process within the HSE. So we're hoping to actually roll this out, these Fidelity Reviews out in spring 2022. And all areas will take part in the Fidelity Reviews, which are funded nationally by our office, except for CH09, who have just completed their own Fidelity Reviews. And yeah, so we'll be in contact around the Fidelity Reviews in the new year. I might just pause for a moment and just look at some of the questions that are coming in. So funding for how long? Michael, do you want to answer that one? That's sustained funding.
So the funding has come from the Department of Health, and it will go into the mental health budget, and that money will continue every year. So I suppose it's indefinite. It's like it'll be just part of the budget that areas get for delivering their mental health service. It's basically long-term sustained funding.
Yep. And just to answer the other two questions that are coming in, they're kind of a general answer for those at the moment. The funding will continue as is for the moment, but we are looking to, I suppose, to make plans around how we manage the sustained funding and what we possibly need to change around the model. So there'll be a lot of work done over that, over the next 12 months on that. Okay. Right. So the next piece I'm just going to speak about is training. And this is a huge piece for employment specialists. And at the beginning of last year, we did quite an intense amount of training for people that were new starters. There had been about a year's worth of training to catch up on. So we did a number of different types of training at the beginning of last year. And there's been some calls for more training for new employment specialists. So we haven't had a huge amount of new starters, single figures. So I suppose we're trying to wait until we have a good amount of people to justify the training as well. So what I hope to do in early 2020 is to do a training needs analysis with employment specialists and those who work in IPS to see exactly what areas of training are needed. So this will also, I suppose, go alongside national training that will be provided to new starters. We've had some kind of suggestions for bespoke pieces of training as well, and we hope to take to do those nationally. But what I would say is if local training is available, please do take it up where possible. That I suppose, like, we will be doing some national training, but if a local opportunity does arise, please do take it. And as we all know, we should have been sitting in Portlaoise today at a face-to-face community of practice, and obviously that wasn't possible with the current COVID situation. So we really are hopeful that we can hold that in Q1 of 2022, and that it'll be a face-to-face event. We were delighted to be able to do something today to just kind of, I suppose, mark the end of the year and celebrate the work of employment specialists and IPS throughout the year. So Niall, you can just come on to the next one. So as many of you may know, I recently travelled to Iceland for an IPS Europe learning community meeting. So this was the first of its type. So I've been meeting with IPS representatives from across Europe for the last year or so, and we meet obviously on Zoom. So this was the first face-to-face meeting, which had been postponed a number of times. And it was, I suppose, an opportunity for people that were new to IPS, but also those who are quite experienced in IPS across Europe to get together to learn from each other and to discuss kind of common issues, but also common successes. And it was excellent, I have to say. It was really, really beneficial. And it made me really realise that Ireland is in a great position. Having only started IPS a couple of years ago, we have, as Michael said, 35 employment specialists. Some countries have only 2, so that was, really, really great to, I suppose, to see where we are on the IPS field. So some commitments were made after the learning community, and we have 5 pieces of work that we're going to work on. So there was 15 countries in attendance at that, with about 50 people. So Niall, if you just go on to the next slide, it outlines sorry, back one, it's just the kind of diagram, and the next, no, back 2 then, thanks. Yeah, this one here, great. Okay, so there's 5 key areas that we're going to work on as a collaborative piece. So gather best practice in IPS implementation across Europe, and we're going to create a manual to support this. There's going to be an association created, so to make it more structured. create a knowledge management portal and create a working group to agree on what outcome metrics and how to gather outcome data. So data was really important to the whole, I suppose, 2-day conference and how everyone was collecting data, and to create networking and educational programs for employment specialists and team leaders. So this was really important as well. Over the 2 days, like whilst I was there, none of our employment specialists were, so we spoke quite at length about how we could set up networks for employment specialists across Europe, and even in the US as well. So there's plans in place for that now, which is excellent. So before I hand you over to Colm, I'm just going to check the questions. There's a question just coming in there around the local implementation groups and employment specialist representation on the groups. Yeah, I am aware that some local groups have employment specialists on their group and others don't. So perhaps, and thanks for that question, Geraldine. This is something that we could look at the makeup of the local working groups. I wouldn't say that sharing the vision has slowed down the production of the next SOP. I would say that I suppose we're using it to strengthen the case for IPS, and also we were waiting on the sustained funding, which has been fantastic to get. So that's another question that came in there. Yeah, absolutely, Antoinette. The funding continues now past June 2022. Michael, do you want to say something on that?
Yes. So the funding goes to the local service in each CHO, and they will then use that funding to secure an SLA, an agreement with organisations that such as Employability or InLane or whoever is providing the service in a local area. So in terms of the employment aspect of it, that will be worked out locally.
Okay, now I'm just going to hand you over to Colm. I think Colm has joined us, and Colm is going to update on our data collection piece.
Hello, everyone.
Hi, Colm. So Colm, you're going to share your own slides. So Niall, if you want to stop sharing, that would be great.
Hi, if anyone doesn't know me, hi, my name is Colm Kelly. I work with Mazars. I'd say a good proportion of you do know me. I've been working with Aisling and Michael and Debbie and a lot of you now for several months in relation to the data monitoring. So here, just to give you sort of a quick update on some of the statistics that we have collected. So it's really sort of averages as well, but I'll share my screen. And then I'll just talk about sort of the various phases in relation to the data monitoring as well. Share screen. Yeah, so like since the launch, there's been sort of approximately 1,200 service users, which is a huge amount. Since the start, so this would have been back in the Genuo days where there was a pilot program, and then that's just been expanded ever since then, and that's a big number. The average caseload then per sort of employment specialist is around 14. But it tends to range though, like if obviously when some people come in, they'd have sort of like less than that, and then other people are at up to the maximum number of 20. The number of employments that have occurred over the last couple of years is around 500, and that's for the actual people who, for example, progress to doing the interviews, etc. There's some numbers out of that 1,200 that may not have actually progressed beyond, say, a pre-assessment stage. So the number of employments, 500, is pretty significant, and it works out for the service users who get to going for interviews and getting employment. For each one of those individuals, they tend to secure like 1.2 employments, and that's a huge success, especially when you consider that several of them may have been unemployed for a period of time. Now, the statistics between the gender sort of evenly divided.
Niles, or sorry, Colin, just come in there. Your slides aren't showing. I don't know if you're hoping to. Yeah, just to say that. Sorry. Perfect. Yeah.
You see
there
now?
we go. Yeah.
Apologies. Thanks. I thought they were showing. Sorry. Yeah. You can see there on the screen now. The gender split is fairly evenly split. And then sort of 77% of the sort of service users are sort of under the age of 44, and 23% or so were sort of like 45 years or older. When it comes to sort of the educational level, what we saw was that there's sort of like a good split between primary and secondary education. Then after that, then sort of the average length of unemployment was around 47 months, and most notably, the sort of male participants between the age of sort of 45 and 55 were the ones that were sort of unemployed for the greatest length of time. Some of them, for example, could have been as high as of like over 7 years. The status of the participants, sort of 32% of sort of the participants would be sort of in the pre-employment stage, such as job search and CV participation. Around sort of 48% were in sort of job support, and out of the total, let's say the 1,200 that we were looking at, so 18% had exited the program, and then sort of 2% were sort of performing other activities. Yeah, the referral pathway. So 70% of the service users tended to be sort of referred by sort of a primary pathway, such as sort of clinical or mental health service, and then sort of 26% were by secondary pathway, and then 4% tended to be by sort of tertiary or CMHT pathway. The sort of employment type, so the split between permanent or temporary. So the sort of would it be like a permanent or a full-time contract versus temporary? It's like a part-time contract. But the split between that, when it comes to the sorry, I'm trying to find the statistic here. One moment. Sorry, I have a separate slide here beside me. I'll move on. I'll come back to it. The current employment status, there's around 60% of the people who were sort of actively looking for work were employed, and then sort of 40% were unemployed. And now out of the 40% that were unemployed, the mode of them, there was half of them, for example, that were inactive in the program itself. The route to employment, the average number of sort of employment applications tended to be between sort of like 4 and 7 before someone got an employment. The employment secured, so it was an average of sort of 1.2 employments were secured by sort of the service users, which is a great achievement, especially when you look at some of the groupings that for the length of unemployment, if the average length of unemployment is around sort of 50 months. So it's a great achievement on them securing sort of 1.2 employments. The average welfare amount that the people were on was approximately 220 euros. And then so the average reduction in welfare per service user once they joined the IPS program and once they gained an employment would have sort of reduced by sort of 73 euros per user. And that's sort of like an annualized cost when you work it out of around 1.5 million when you multiply it with all the service users that are there on a yearly basis. So it's sort of it's significant to look at it from a cost benefit analysis basis. I know that's not sort of one way. It's one way to look at it, and I know it's part of a bigger picture there. Now separately, what I'll just do is just talk about the journey so far, sort of like the various stages to it. So probably nearly a year ago now, yeah, we started on this journey, and was to engage with Aisling and Michael, and we sort of engaged with a lot of the employment specialists and the OT managers and coordinators at that stage. And we're sort of back in March time when we sort of received a lot of the data monitoring information. So at that first stage, it was really just to consolidate all the information, take it all in and have a look at it. And then we did sort of a data quality review. So this is more or less a comparative between all the various data monitoring spreadsheets that were being utilized across the entire network. There was around approximately 30 spreadsheets. And one thing that we noticed was that the vast majority of the spreadsheets did contain very similar information, but very few of them, only a handful of them, for example, had the same number of columns and were capturing the same information. And the reason for this was that it just had evolved in that people, when they joined as an employment specialist, were sent a spreadsheet and an additional column was added. They may have added an additional column, etc. And it was just part of sort of that organic growth. So there's an element then at that stage just to sort of go back and see, okay, can we say, for example, do sort of a data quality review and then provide feedback? And in that instance, it was just to try and get the basics right, which was if information is required to be populated, to populate it. If there is a date field, for example, just have consistency on how a date might be in. Like there is a sort of a range of dates put in, and it's fully understandable because I do it myself in that, like, you put in like numbers, or else you actually type in the actual word for the actual month itself. So that exercise sort of occurred, I think it was between sort of March and the summertime. And then after that, we had sort of a series of workshops then as well on, okay, sort of what's working well, what isn't working well, what type of information is going to be captured, what information people felt that is unnecessary to be captured, and that would have occurred, say, over the summertime. A lot of employment specialists would have joined into those workshops. Then we developed sort of a couple of different pilot tools, and a handful of people volunteered as well to actually utilize those pilot tools. What we did was we looked like look at a Google form. We looked at like a Microsoft Forms tool. Form, and then we looked at sort of Excel, and they all had their pros and cons, but on balance, an Excel was best to be able to see all the information and to be able to capture all the information. Some of the limitations of the online forms was that you could only sort of put in one piece of information for a service user at a time, but there wasn't any sort of consolidated view to see them all together and to give you sort of good statistics in relation to it. So we did gather feedback from a handful of the employment specialists that volunteered to do it, and that sort of fed into sort of like the new data collection sheet, which we sort of developed. Now, the objective of the new data collection sheet, which many of you have probably seen or received a copy of it now, is to try and make it easier for people to capture information, and it's to sort of like, where possible, to have like a drop-down menu or to have a formula calculating the information that's required, and that just sort of like speeds things up, hopefully. So you can select, for example, from a drop-down menu, an employment specialist name. You can select from a drop-down menu the number of interviews, for example, and then sometimes it'll actually do an automatic calculation between two dates, which is helpful as well. And so really, it's to actually eliminate information that was in the old data collection spreadsheet that isn't valuable, that isn't being used, and to try and introduce new information as well that will be used going forward, and to create a series of reports as well. So within the data collection, the new proposed one, there's like multiple tabs that show sort of reports and summary of information, which people may find helpful. And then also going forward as well, all the information will be sort of consolidated on a national level so that reporting can occur. So some of the statistics we were talking about earlier about sort of the gender, the length of unemployment, the success rate, etc., can be sort of consolidated more on a frequent basis, and that can be built up over the next couple of years. Then over the last couple of months as well, there's been sort of several demos and training, and hopefully the vast majority of people have attended it. So where we are at the moment is that we sort of issued out the new spreadsheet just for people to become aware of it, because it's a pretty significant departure from how the information is currently being captured in Excel. I'm sure you're all very familiar with this, but I'll just explain it just in case. And that the current way, it's a very big Excel spreadsheet where you more or less stop it, or you start at the top hand left hand side, and then there's a high volume of columns the whole way to the right. And just to highlight the point, like with some of the spreadsheets that people have at the moment, for example, they may have, for example, 50 columns of information where information can be captured, but in other instances it was at 200, 300. So there's a pretty big range there. So at the moment, yeah, it's been really helpful, and I'm really grateful for people who've provided really good feedback in relation to the current spreadsheet, and also to think about and to propose questions as well operationally how things should work, because we can actually make changes now before it going live then as well. So then, yeah, it's over the next couple of weeks, we hope to go live with the actual spreadsheet itself. But prior to that, then it's to get all the data monitoring spreadsheets that are currently there, to receive them in, to get the information that's sort of inactive or exited, and put them into sort of like a separate spreadsheet or database where people can access, and to try and go forward with sort of an active caseload and a clean start with it. But being able to actually see your full historical information plus your current information. And then after that, once it goes live, yeah, there has to be support. So we have created a guidebook which will update once all the feedback comes in, just so it reflects what the spreadsheet does, but also to be available in case people get to the spreadsheet and they just have a query or a question about what do I do in this situation, or there's a drop-down menu where a piece of information should be included, a name might be missing, we need to include it, and that's sort of the support that's available. That always works best when something like this does go live, because there's nothing worse than sort of a spreadsheet or a new tool not working, and you have to submit the query through a web page. It's always easier if it can be sort of via email and then a phone call where you can share the screen and you can see what's going on. Sorry, yeah, so that's more or less a whistle-stop tour of the statistics, and then more or less the journey so far. I'll stop sharing my screen now.
Thanks, Colm. Does anyone have any questions, or just to say thanks to Colm and his team, and for everyone working so diligently on this for the last year. It's been a huge project, and yeah, I think it's going to be fantastic once we get up and going. But even so far, it's been really worthwhile.
Yeah, simply thanks very much to everybody. It's been great working with all of you, and it's really helpful to get that feedback.
Great. Okay, thanks, Colm.
Thank you.
Talk to you soon. Okay, we're going to have Karen O'Connor now from the Early Intervention into Psychosis program speaking about IPS in that particular program. So you're very welcome, Karen.
Thanks, Aisling. Will I share my screen? Will I work from here?
Yeah, absolutely. If you're able to do that, that'd be great.
It just says host disabled participant screen sharing.
Yeah, Niall will make you a co-host.
Fine. That's fine. Great. Yeah, I have it. Yeah, perfect. There we go. I'll try now. So I have 8 minutes, so I'll do my very best to get this into time. 1 second. I'm blocked at the top of my screen now and I can't see what I'm doing. 1 second.
Your time, there's no panic.
There we go. Okay. Now, okay, so yeah, thanks very much, Aisling. So I'm the National Lead for the Early Intervention and Psychosis program. So what I'm going to focus on just in the short time that we have is telling you a bit about EIP, which you may well know already, but I'll just give you, I'll give you the kind of the headlines of it, and then tell you how IPS is fitting in at the moment and where we see it going in the future. So I suppose the whole idea behind early intervention and psychosis is threefold. What we know with treatment as usual, so before there were early intervention and psychosis services. And the major impetus to develop early intervention and psychosis services is because people who develop psychosis often have the symptoms for a long time, so on average 2 years before they ever actually get access to treatment. And then when they do get access to treatment, they tend to present in crisis, very, very unwell. They often end up coming into the emergency department. It's a crisis. They end up being admitted to hospital. Sometimes it's an involuntary admission. And this kind of, they end up getting some treatment, but often it's a medication-focused treatment. They don't necessarily get access to the full range of interventions that should be available. And then once they leave hospital, often then they leave services quickly afterwards. And this kind of cycle of crisis and disengagement, and then representation and disengagement, it results in very poor outcomes for people. And so there's been an early intervention in psychosis kind of movement that grew out of the awareness of that. Can we do this differently? Can we identify people earlier? Can we give people a much better experience of services? And can we offer people a range of interventions and not just be focused on medication? And I suppose one of the big things, underneath the ethos of early intervention and psychosis services, can we look beyond symptoms? Can we look at what the person wants for themselves? What do they want with their lives? Where do they want to get with their lives beyond just symptoms or no symptoms? So the early intervention and psychosis services, they aim to kind of improve outcomes for people, and they have been demonstrated now across the world to very significantly improve outcomes for people. And they do it in 3 ways. One is by reducing delays and inequalities. So by increasing awareness of symptoms and in the general public, trying to reduce stigma around these types of symptoms, and then providing rapid access to expert assessment. Then to maximize recovery by providing a range of evidence-based interventions, including IPS or employment support type interventions, but IPS is the one with the best evidence. And then focusing on engagement, building relationships, building understanding of the person and their context, and then address comorbidity early, help people to achieve what they want out of their lives, and then prevent relapse by ensuring assertive follow-up. So each person gets a dedicated key worker who could be from any discipline. And then there's a multidisciplinary team approach. And the IPS worker is a core team member of that team approach. And then focusing on psychoeducation and involving family and significant others from very early on, and having, I suppose, a family sensitive approach to care. So these are some of the values underpinning. Sorry, this is just in my way and I can't see my slides. Sorry. I'm not used to Zoom actually. Okay, I'll just ignore that. So look, it's about hope and optimism, having a youth-friendly approach, low stigma, involving family and carers early. And as I've said, that focus on functional recovery and symptom relief, not just symptom relief. So historically, it would have been all about symptoms. Actually, obviously people are much, much broader than that, and recovery is a much broader process than that. Okay, so where we stand at the moment, there are 5 early intervention services in Ireland, but they're at very different stages of development. So Detect is the longest standing service. That's in Dublin. It covers parts of South Dublin and then North Wicklow. And then there's AIST. So Detect is running about 20 years. AIST is running, I think, 9 years. It's in the north side of Cork City. And then there are the three what we call demonstration sites, but actually they're now funded on an ongoing basis. So they're no longer demonstration sites, but that's how they got funded originally. And so there's RISE in Cork, which was launched in May 2019. Sligo, I need to update my date here. So Sligo was launched 23rd of October in 2020, and Meath is launching early. The plan was early this year, and now it's probably going to be early next year. But Meath is significantly in operation really at this point. They have probably about 3/4 of their staff on the ground. So once national rollout is complete, there'll be more than 20, there'll probably be more than 25 EIP services in Ireland. So the reality is we're actually a long way from full implementation. And Detect and AIST, this is important to flag, they are not adequately resourced at all. So a service like Detect covering the large population that it covers, which is about 380,000, it would need, staffing of 30 plus staff members. And they had at the beginning of last year, I think 5.5 WTE, and they did get additional resourcing last year, and they will get some additional resourcing this year. AIST was so under-resourced over the summer this year that they actually had to pause access to services because they didn't have enough staff. They are getting some additional resource this year, but just to be clear, we're a long way off national implementation. So the evidence-based interventions that we talk about in these services are pharmacotherapy, so start low and go slow with medication. Physical health monitoring is really prioritized, and offering people interventions early and taking account of physical health early. Psychological interventions, CBTP in particular, so cognitive behavioral therapy for psychosis. Family supports, as I said, family sensitive care is very important in the EIP approach. And then offering specific interventions. So it might be group family work, or it might be behavioral family therapy, which is offered on an individual family basis, or systemic family therapy, which is offered on an individual family basis. And then IPS is a core intervention of EIP programs, and it's a core element of our model of care nationally. So just where we are at the moment, we have 2 IPS workers in RISE in Cork, and they've been working with us since that launch in May of 2019. We have 1 IPS worker in Sligo in that EIP service at the moment, and we have 2 IPS workers who will soon hopefully be recruited to Meath. And that recruitment has just been delayed around technical stuff, but hopefully that will happen soon. And the Meath service are very keen for that to happen very soon. In 2022, hopefully we're hoping to recruit 2 more IPS workers to EIP teams. So 1 will be going to Detect in Dublin and 1 going to AIST in Cork. So just our experience of IPS in the EIP services that exist, hugely beneficial on multiple levels. So I would say IPS workers bring a different perspective to the team, and it's an extremely welcome perspective. Our experience in Cork would be that they see things that we don't see, or they see things through a lens that we don't see it through. They often engage much better with particular service users. So some of the service users that I probably find the hardest to engage would be young, some of them more marginalized, maybe young men. They don't really want to talk to me about their symptoms. And then when I try to talk to them about other stuff, sometimes I struggle to find common ground. Whereas actually, I often find that the IPS worker will have a much better engagement with them and will have a much better understanding of where they're coming from. And they'll be much more open to engaging with somebody around employment opportunities and or education opportunities. Whereas they see talking to me as, talking to a medical professional, whereas they're very, very keen to talk to the IPS workers. And it'll often happen at our team meeting that I'll be saying, God, I'm struggling with this person, I'm not sure where they're at. And another team member might have a different experience, but often the IPS workers will say, well, actually, I had an hour-long conversation with them when I met them for coffee and we went for a walk, and actually they're really keen on this, this, and this. So, we found it a really, really positive, great experience for the team and for the service users. And that's it. So I didn't manage to keep to time, did I?
Very swift.
Yeah. So sorry, I had the thing was across my slides, so I actually couldn't see them myself some of the time. So sorry about that.
No, that was
I'm
excellent.
happy to answer questions, but there may not be time, so that's fine. Thank you.
No, that's fine. If there are any questions, thanks, Karen. That was a great whistle-stop tour. Perfect. Okay. So I suppose all that's left at the moment is just to say thank you so much to everyone who's joined us. I'd like to say particular thanks to our working group, which was set up to organise a community of practice, and obviously our focus changed, but the working group remained on, and we met once a week over the last 8 weeks to discuss today and the community of practice. And just to say thanks to everyone on the working group. As I mentioned already, we hope to have the community of practice early next year. And, we had, I suppose, an agenda laid out for the community of practice and some ideas of topics we'll be covering, but we will revisit this again because some of those topics may be covered in training before the community of practice. So we there's loads to cover anyway, so we won't be short on topics. Just wanted to say that, as Michael mentioned, thanks to everyone who's involved in IPS. It's such a successful program. The feedback we get day in, day out is that it's one of the programs in mental health that just is really welcomed and by all, and the intervention is fantastic for those people that are using the service and their families and supporters, and it's making a real difference to people's lives, which is the main thing, that people's quality of life is really improved and being benefited by IPS. So a particular thanks to employment specialists and all those who support them. So our OT managers, our employment partners, anyone on the teams. I know there's way too many people to thank, so I will forget someone if I keep going. So just to say now, thank you to everyone who has joined us. Employment specialists, if you remain on, that would be great. And everyone else, hope you go and get some nice coffee and enjoy the rest of your day. And look, as I said, we'll be coming back to you with all the feedback as well over the next couple of weeks.